The challenge a bit I've noticed with new moms is that there are very many people who now come with all sorts of advice. Mother-in-law, sister-in-law, neighbor, even a passerby will just come with some advice.
Everyone, I'm Shikonguru on site here at Riverdale Medical Center with Dr. Okello, who is the resident pediatrician here. And I'm here to talk to him about a few things that moms like me have questions about. One of them being, when you get the baby home from the hospital, there's always this moment of minor panic. And I know I'm like that a lot, I panic a lot, but what are the things that moms, in your experience, panic about the most? Like your top 3 questions or worries you get from new moms?
The top 3 questions that new moms usually have is, 1, do I have enough milk? Is my baby getting satisfied? The other thing that they panic about is yellowness of the eyes or yellowness of the skin of the baby. So sometimes they may notice that the baby has yellowness of eyes and they're not sure what that is. So they can have a question about that. The other thing would be the baby is crying a lot. So they would panic that, is there something I'm not doing right? Or is there something I'm leaving out? Is the baby satisfied? So it's like revolves around the crying of the baby. So especially when the baby cries a lot and it's a new mom, she's not sure what the problem could be. But she gets anxious because the baby is crying a lot. So those are the main concerns. A fourth one I would say is usually like, when can I take the child out to the sun? Like, so some moms, they want to stay with the baby in the house for about 4 months, and you tell them no. I mean, you should start going out immediately, you get. So those are some of the concerns. Things like pacifiers. Do I need to give the baby a pacifier? Is it good or bad for the baby? Do I give the baby gripe water? And then the challenge a bit I've noticed with new moms is that there are very many people who now come with all sorts of advice. Mother-in-law, sister-in-law, neighbor, even a passerby will just come with some advice, you get. So there's a bit of a challenge because they get all these sorts of advice, and then there's Dr. Google, so they'll be there Googling. So now with all that, sometimes they're a bit confused how to filter out like what is actually correct and what is an old wives' tale or a myth. Yeah, so that's basically the challenge of new moms. They are not very sure about certain things because they get all bombarded with all sorts of advice from different quarters. Yeah.
Right, and so with all, like you're saying, there's Google, there's mother-in-law, and there's also our own worries as moms. When do we know if it's a real issue? Like, what are the danger signs that we should be like, okay, if I see this, then I need to call my doctor? Like, this is not a joke. I don't need to go to Dr. Google. I need to take the baby into the hospital. What are the major danger signs or warning signs?
The major danger signs in a baby, especially a newborn, but any baby, any infant, is the number 1 would be poor feeding. So if the baby feeds poorly, does not have energy, does not cry with energy, like a loud, strong cry, then get worried. If the baby sleeps too much, so it's like if you find your baby is sleeping 5 hours, then you get concerned. It's not a good thing. So some mothers think that, oh, this is so nice, this baby is so nice, he's always sleeping. I say, the baby is always sleeping. When does the baby eat, you get? So the challenge, the one big danger sign actually is poor feeding. Then the other is fast breathing. So if the baby is breathing fast, and how you know that the baby is training to breathe, you look at the nostrils. So if you notice the nostrils are flaring, then that shows you that the baby is getting distressed. They are straining to breathe. And then you look at the chest of the baby. If you notice that the lower part where the ribs join the abdomen here, if you notice it going inside, or the spaces between the ribs going in, so that's called intercostal recession or chest indrawing, that is a danger sign. It means that the baby is struggling to breathe, difficulty in breathing. That's a major danger sign because usually that can indicate something called pneumonia. And pneumonia is a medical emergency. So The key ones are poor feeding or refusal to feed, the baby being lethargic or like weak, and that usually would be the baby is always sleeping or not crying strongly, and difficulty in breathing. Those ones you don't waste time. Sometimes we say fever, but many times early on the baby's temperature may go up, especially if they have not fed enough. So if the baby has not breastfed enough, you might find that they have a slight fever. So usually we just expose the baby, measure the temperature again. But if you notice that the temperature is consistently above normal, above 37.5, then it will also be something worth taking the baby to the hospital too. The other danger sign would be related to poor feeding, could be that the baby is vomiting a lot. If the baby is vomiting all the time, the main thing would be your fear is dehydration. So if the baby is dehydrated or severely dehydrated, that is a danger sign. But the mom might not know how to diagnose dehydration. But usually a baby who feeds poorly usually becomes dehydrated. Yeah. And when they are dehydrated, they are usually lethargic. You get, so they are more or less connected. So in short, if the baby is not feeding well, it's something worth checking by a pediatrician. Yeah.
And you mentioned feeding. I know when you're a breastfeeding mom, sometimes it's hard to know if the baby is getting enough because you can't measure, you don't know how much the baby is swallowing necessarily. So what are the reassuring signs that the baby is getting enough, the baby is okay?
When a mom delivers, we encourage the mom to come and be seen at about 2-3 weeks after delivery. So usually there are vaccines that are given at birth, and then the next set of vaccines are given at 6 weeks, then 10 weeks, 14 weeks, etc. But in between 0 and 6 weeks, usually I would encourage the moms to come at about 2-3 weeks. At that point, we are going to measure the weight of the baby. So when the baby is born, there's something called birth weight, and then when the baby is going home, there's a discharge weight. So usually babies lose a bit of weight even while they're in hospital. And then now what we check is how is the weight gain. So now you have to take a history, because most likely the mom might be anxious, because anxiety or stress can reduce the amount of milk the mom is producing. The mom might not be breastfeeding well, or she may have cracked nipples or mastitis, an infection of the breast. So that can interfere with feeding. The baby may have other issues. You know, sometimes I've seen babies with even cleft palate or cleft lip. They have an anatomical problem causing an issue with them breastfeeding. So if the mom is not counseled well, and depending on where she may have delivered, that can also interfere with the baby's feeding. So that's why I would encourage that it is good to visit the doctor early, even if you don't suspect anything, because the doctor may be able to pick up a problem early and counsel the mother accordingly. So if the mom, let's say, is very sure that she has enough milk, usually you would ask her to express her milk in a bottle that's graduated, so you'd be able to tell how much milk she's able to produce when her breast is full. So sometimes they are very sure that they're able to produce enough, and then when you see what is actually produced, it is something like 20-30 ml, then clearly you know it's not enough, because the baby can easily feed over 100 ml per feed, which is 3 hourly. You get, so on average babies feed about every 3 hours, and depending on their weight and age, they usually would take about 80, 90, 100 ml every 3 hours. You get, so now if the mom is not having enough milk, you have to counsel them on formula supplementation. Yeah.
Okay, and I know for myself and for other moms, there's this question of, do I have a fussy baby? Is this the way newborns just cry? You know, some people say that's a baby, that's what babies do, they cry. Or does this baby have colic? Is there an actual medical condition that's causing this baby to cry? How do you know? What's the difference between a fussy baby and a colicky baby? And what is colic?
Colic is an abdominal discomfort caused by, we don't know. So it's not really known what is the underlying cause of colic, but there are signs and symptoms. So these are the telltale signs that this may be colic. One, this baby usually would cry incessantly for probably 2 hours. You get, so that's how you know it's colic, because hunger, if a baby cries and they are breastfed, usually they'll stop crying. If the baby is maybe the baby has pooped, or you change the diaper, the baby stops crying. But colic is that the baby cries incessantly for hours, and it usually happens at night. So it's not something that happens in the morning, lunchtime. So it's something that happens at night. It usually starts at about 3 weeks or so. So the baby is not immediately after birth, but at about 3 weeks or so, up to about 3 months, you'll find that the baby is really fussy, more at night. Nothing seems to comfort the baby. You have done everything. You have fed the baby, changed the baby, bathed the baby, walked with the baby, watched football with the baby, done everything, massaged. You have done everything, and the baby is still crying. Most likely that's colic. Yeah, so it's like those are the signs of colic. So the age, the type of cry, and nothing comforts the baby. And then it would happen usually several days a week. So it's not like a daily thing, but it can happen twice, thrice a week. Yeah, so it's something that comes and goes. Then the baby cries for a very long time, especially at night, and you have done everything. That's more or less what you can say, like how it presents. So the cause, I would say the exact cause of colic is not known, but there are certain theories that abound now when it comes to colic. So one of them, it could be related to the diet of the mom. The baby may be lactose intolerant. There could be some intolerance to milk protein. The baby could be formula fed, so it's a bit more common in formula fed babies as compared to breastfed babies. It may be more common if you are supplementing breast milk with formula as compared to exclusive breastfeeding. Then it could be related to the mom's diet. So we usually advise the moms not to take chili foods or very spicy foods. If the mom has issues with dyspepsia or gastritis or ulcers or hyperacidity, then anything she eats that may trigger acidity issues in the mom can give issues to the baby. So sometimes it's related to the mom's diet. The other thing is that when a baby is in the womb, you see all the nutrition and oxygen comes through the umbilical cord, and all the wastes go through the umbilical cord. Now, when a baby is born, you see now they start taking orally and they start pooping. So the gastrointestinal system was inactive when they're in utero, when they're inside the uterus. Now, once they are born and they start feeding, there are bacteria that start growing, normal bacteria, normal flora, commensals start growing in the gut. Now, these bacteria, they feed on the milk also. You know, they are hungry. The bacteria need to eat. They are normal. They are protective against bad bacteria, but they need to eat. So they also eat they feast on the milk that the baby is fed, and they now produce gas, you know. So they also produce some gas themselves. So that can also be an explanation as to why the baby has that discomfort. But the gut, the normal flora, it does not keep growing throughout the baby's life and into adulthood. More or less within a few months, 3 months, it's like it's done. So there's also a theory that might be one of the causes of colic. So it's purely biological. It's not something that the mom has done that is wrong. You know, it's not something that she's doing that is wrong. It's something that affects most babies, and it's a biological process because the baby is also adjusting to an environment outside the womb. Yeah.
And so if it's biological, like you've said, is there nothing that moms can do to stop it or to ease the discomfort if that's what's wrong with the baby? Like, what can moms do to reduce fussiness in their newborns?
Generally, there is this talk of dry water. That has been something that has been used traditionally for years, but there is no proven benefit. Like there's a study that was done, and this amount of grape water was given. It's more like it has been used, and it's attractive because it's natural. Then there's a role for the common products in the market that have something called simethicone, which is what is added in most of the antacids that we have in the market. So I'm not here to endorse any product. So generally, I'll just say that there are many antacids that have something called simethicone, and it is used to relieve the discomfort of hyperacidity. Thirdly, it would be something to distract the baby. So it's like you walk around, it's like you probably switch on the lights, you put on something on TV, you can try and massage the baby, you wrap the baby in something, and it's like you're trying to distract the baby. Some even go for a drive. You know, some parents, when the baby is just so unmanageable or just crying, you just put the baby in the back and you go for a ride. So sometimes it's like you're just trying to change the setting, trying to change the environment distract the baby, sing to the baby, hum to the baby. It's like you're doing something just to distract the baby from that discomfort, and it seems to work. Yeah. So, and then patience, you get, yeah. So I don't know, you can't prescribe patience, but it's like you need to be patient because this is something that the baby will outgrow. Yeah, so that should encourage the moms that, I mean, it's not something that's endless and they'll have to suffer and persevere through this for, in fact, they usually ask, how long will this take, yeah? And they get so frustrated, and I can tell, you know, that, but I tell them, just be patient, it'll pass. So that in itself should be encouraging to the mom that this is something that will take a few weeks and it'll go.
A few weeks, that was my next question. When do babies typically outgrow their fussiness or their colic?
Typically at about 3-4 months, yeah, somewhere around there. Usually the first 3 months are usually rocky for any new mom. They don't know what cry is for what. They don't know now what is, you know, like because the baby can't talk, so they're not able to interpret. But I usually tell them, you will learn. Just like the baby doesn't know you, even you don't know the baby. So both of you are getting to know each other, and the baby can only cry to make a demand. It's a process of just adapting to each other as new parents and being a new baby with new parents, you see. Then parents having a new baby. So it's like everyone is adjusting to each other. Yeah, so it's a process.
Thank you so much. Once again, that was Dr. Okello, resident pediatrician here at Riverdale Medical Center.